want to talk about a device that I can't live without in my dental practice, the X-Trac system. When you have a tooth like this that's got a bunch of big fillings and broken down and it ends up decay, it just ends up being pretty flat with the gum line or the alveolar crest. How do you extract that tooth without removing a lot of facial or palatal or lingual bone? Well, the X-Trac system extracts the tooth straight out of the socket, so you preserve the bone on the facial surface and in this case the palatal surface. You can see all the decay on this tooth, and remember, when you see what you see on a radiograph is normally only about half of the decay that's actually on the tooth. The rest of the decay is not radiolucent enough to show up on the radiograph. So this is the tooth, just broken down old composites. So the first thing you have to do to use the X-Trac system is cut the tooth off flat with the gum line, because when you screw this extraction screw into the root of the tooth, you want the shoulder to fit flat against the tooth. You don't want a hump in the tooth like this, or it won't fit flat and it won't extract the tooth well. See all the decay here, and that's just a nightmare if you don't have something like this system. There may be another system like the X-Trac. What you're looking for is something that will take the tooth straight out of the socket if you're planning on placing an implant, because then the facial bone, and in this case the palatal bone, act like a little sleeve to put the implant into or to graft into. If you try to take this tooth out without the X-Trac, you're probably going to have to take it out to the facial, and in that case you're going to lose all that facial bone. You'll see the first thing I'm doing is removing the decay and just flattening the incisal surface of the tooth. And this is a football diamond, coarse football diamond. Then there are 3 of these drills. Each is a little wider. Now the screw that you're screwing into the tooth is only 10 millimeters long, so there's no reason to go more than about 12 millimeters into the tooth. I normally go a couple of millimeters further. It doesn't matter if you drill through the apical part of the tooth just a little bit. So I normally drill about 12 millimeters just to be sure I've got plenty of depth into the tooth, and you're drilling right into the root canal. Just light pressure, let the drill do the work. If the tooth has had endodontics, it makes it easy. You just drill right into the gutta percha. And I took out a tooth the other day that had an old silver point in it, and just removed the silver point and go right into the endodontic fill. So we're going to put this endo stop on the drill, in this case at 12 millimeters, and when I get to the stop, you're going to stop right there. So you can see there are 3 different sizes, the white, then the red, and the blue. So this is the second drill, and it's easier once you've done the first one. And it doesn't matter if you drill a little bit through the apex of the tooth. Then you screw this screw into the hole in the tooth, and there are different widths of screws, and you have this ratchet wrench that screws it into the hole, and you can see the flat shoulder on the screw, and you want that to be up against the coronal part of the tooth where you flattened it out. See, that's what I'm saying. You want this to be in intimate contact with the coronal part of that tooth so that it's got a good brace against the tooth. And don't over screw it. You don't want to strip it and make it spin in the tooth. If you do, it won't hold. It'll come out. You want to tighten it until it gets tight, and hopefully that's when the shoulder connects with the coronal part of the tooth. Then you try the tray in, and this is just Blue Moose fast set polyvinyl siloxane. So you need to go ahead and move when you squirt this in, because it'll start to set up. Now this is a part that I didn't figure out until I'd been using it for a while. The teeth of this extractor fit right here, and you want this to fit in there perfectly. You don't want a lot of space, because as soon as this catches, as soon as you start screwing it and you feel pressure, You want that to be engaged in this region. So as soon as I put the tray into the mouth before the blue mousse is set, I put the teeth on this so that it's exactly, the tray is seated exactly the right amount so that there's immediate pressure on the screw with this extractor. And you tighten this part, and that moves the jaws of this part and puts pressure on the tooth. So don't just keep tightening. Maybe you can just tighten. I screw it about 15 turns and then take a break and wait for a minute or so. You can go check a hygiene patient. Sometimes when you come back from the hygiene patient, once this thing is tight, the tooth will be extracted. It's possible that you can just screw it all the way and the tooth will extract. I've never done that. I just screw it about 15 screws and then maybe 5 or 10, and I'll take a break in between, because you save a lot of time if it works and the tooth is extracted. Now what if this pulls out and the tooth doesn't extract? Then take the next widest screw and screw that into the tooth. I've had that work. If there was decay or for some reason the smaller screw in width didn't extract the tooth, you can go back with the one that's wider, and many times that will do it. But take your time. You save time extracting the tooth with this easy extract versus having to drill the tooth out. So whenever the tooth extracts, you're going to feel it go, it'll just give, and you know it's either pulled out of the tooth or it's extracted. Most of the time the tooth is extracted. There it is. That's the Dental Minute. These techniques work, and they work every time.
Are you ready to take your dentistry practice to the highest level possible? Of course you are! Subscribe right now to dentistrymasterclasses.com, where you will get Dr. Cutbirth's greatest work and best cases. Here's what you're going to get when you subscribe to dentistrymasterclasses.com. Incredible comprehensive cases not seen in Dental Minute videos. You will get an organized library of all the Dental Minute videos and Dentistry Masterclasses, comprehensive cases for study and reference, before and after photos of Dr. Cutbirth's fantastic restored cases. And all of this, I repeat, all of this is just $40 a month. This is something you cannot pass up. Subscribe right now to dentistrymasterclasses.com.